I wanted to ask you about that approach to the neuroshaping, and you've talked about some positive psychology. Are there any other psychology theoretical frameworks that are underpinning how GHEORG does this?
Yeah, we weave into the stories some cognitive behavior therapy and some acceptance commitment therapy as well. ACT's like acceptance commitment therapy, ACT is really on the rise in terms of popularity now for psychologists, and that's great because it is such a good thing to teach kids that you can have these challenging emotions, but they do pass. That really, really helps. So it's woven into the stories to help them to understand how to navigate this challenging emotion territory.
What kind of things does GHEORG do across the course of time? What does he track? Does he feedback? And if so, who to?
Yeah, absolutely. In fact, this is one of the benefits of digital mental health. The capacity to track symptoms and the capacity to to kind of recognize when it's time to actually get a human involved, get a human psychologist involved, perhaps. And he helps parents do that. So children are, they get to see how often they kind of use the calm down function that he has, and how they generally feel over a time frame, a bit like you would track, you're running or something. But parents get to actually look at behavioral indicators of anxiety and get to actually tick those off over a time period so they can track when these things appear. And they may look at those things and not see any, which is really comforting and helpful to parents who may be worried about this. But if they do see them, then they can also think, okay, well, it may be good to go and talk to people. Initially, probably the GP, initially, probably the teachers, which is great. And then when they're ready, they can actually go and see a psychologist. And then they have this database of information about when symptoms started, what those symptoms were, and how they kind of progressed, which really helps diagnosis. Children have their own language in therapy, which is awesome, definitely part of the best bits of working with kids. But sometimes it can be hard to understand at first. It takes time to build that rapport sometimes. And GHEORG can speed up that process of diagnosis simply by this collection of data that a psychologist can then look at and go, okay, I see something here.
That's really interesting. I'm kind of just working through a few things in my head. I'm obviously pretty excited and focused on digital health and how we actually do it and how we modernize healthcare. And one of the things that I talk a lot about in the industry is the idea of designing the experience for the client. And from your point of view, you've designed GHEORG to be a relatable and engaging character who is something that's quite attractive and cute, I guess, in being that kind of easy to interact with, and forming that kind of relationship with the child. And so I see the journey there as far as how the child will get access to GHEORG and how the parents would want to participate in that. And that's sort of the client interaction with GHEORG. But on the other side of the equation is a practitioner who may be working with the child or the family to support the reduction in anxiety. So clinically, what comes out the other side? How does the psychologist work with GHEORG?
Yeah, at the moment, this is also very simple. We actually want to work more closely with more psychologists. So we obviously work with a few since I'm one, but we need more really to really advance what we do here so that it works for more psychologists. We asked parents actually, first of all, what would you like? What would you be most comfortable with? And they said, oh, well, I'd just be most comfortable with me handing over my device so that they could see what I've been noticing, and then I can take my device back. But I think as we go along, that will actually change. We have noticed that with George already. Initially, parents said, I want George on my phone, and then I can hand it to my child, and they can actually use George that way, which is exactly how we built him. And now parents, after they've, gotten used to George, are like, oh my gosh, no, this is not working. We really just want George on the child's iPad, and then I get my phone back. So George is actually not terribly addictive. So it's a good sign. He's built that way. He's not Pavlovian addictive. So it's a good sign that they actually really like him. But a really good sign that parents can start to feel comfortable with this kind of technology once they see the benefits of it. So that's really awesome. And we think that's what's going to happen once psychologists start to engage on the therapeutic side. Parents will have this, we think, the same effect. They'll start to go, I think it's okay. It would be nice if the psychologist could also see this data. So that's actually in our plan for the future. But yeah, obviously we'll see how we go. We're very, very committed to looking after our kids first and our parents, and making sure that they're very comfortable. So we'll see.
Would it be fair to describe George as a digital mental health intervention or a digital mental health therapeutic? What's the right way to position it from your point of view?
Oh, it's a good question. I'm not sure, actually. I think probably I'd describe him as an intervention at this point, because he is quite simple and he doesn't directly connect to psychologists yet. I think once you're directly interacting with the health professional, then it moves on to a therapeutic, because it can be a lot more sophisticated based on whatever basically homework they might prescribe to help the child. So eventually, yeah, he'll be more sophisticated. But at the moment, he is quite a simple character. We actually want to get so sophisticated that George could, there's some great research out of the US on using tone of voice and language to diagnose mental health conditions. And we would like him to get to that point that he could actually do that. But at that stage, he really is quite a sophisticated engine, and would love to see that connection to human psychologists alongside that.